next one. So it's my privilege to introduce Maria Stanley. Maria was the president of DSMIG when this idea was hatched, and so we really thank Maria for all that she has done to help this happen. Maria is a developmental behavioral pediatrician at the Weissman Center at the University of Wisconsin in Madison, and where she runs the pediatric Down syndrome clinic. Did a residency at Boston Children's and medical school at the University of Chicago down the road here. And Maria, we're really looking forward to Maria's presentation. So welcome, Maria. It's all yours.
So I am feeling humbled and pretty overwhelmed by the amount of expertise that's in this room today. So I hope I will do justice to this amazing inaugural session. This, just to start off, we were going to just go over the learning objectives, and we're going to talk just briefly about some of the current challenges with access to care for individuals with Down syndrome, talk about how DSMIG USA is working to improve access to information about care for individuals with Down syndrome, identify resources that are available to support evidence-based care and best practices for care, and then describe the model of Project ECHO and how it serves to promote knowledge. I thought I would just start with some historical perspective, looking at who's in this room. I'm guessing this is not new for any of you, but I always just find it interesting to reflect. John Langdon Down was the first person to describe Down syndrome, and looking at his title, it just helps us recognize how far we've come in terms of our understanding of disability and the way that we talk about it. Trisomy 21 was identified as the cause of Down syndrome by Jerome Lejeune, who tends to get credit for it, but the unsung hero and partner in that work was Martha Gautier, who was a woman scientist and did not get credit for her significant contribution to that work. Next slide. So just a little more historical perspective, and I'm guessing many of you have seen these curves, but I just always find it so amazing to look at what life expectancy looked like until very recently. And you see here that the mean and median life expectancy for people with Down syndrome until just the last several decades was really that most folks died in childhood. And with deinstitutionalization and improvement in medical care for people with Down syndrome, we've made some really significant strides. And it's just, again, helpful to reflect on that and also to think about where we still have to go. Next slide. There remains some inequities. This slide, I'm sorry, because it's a little bit small. I don't know if you can really see it, but basically the blue line is all individuals in the United States, and it is mortality in the first year of life. And you can see that kids with Down syndrome do still have significantly more mortality in the first year of life. And the line that's above the black line is mortality for Black children with Down syndrome in this country. So still some gap based on race. And then the slide next to it shows, again, average life expectancy. And if you can see there is, again, some small discrepancy for folks who are non-Hispanic Black individuals, as well as Native Americans. And so, again, those gaps in care that we still need to be thinking about, as well as the bigger gap in care and life expectancy for people with Down syndrome from their neurotypical peers. Next slide. Some general access information for people with Down syndrome compared to other children and youth with special healthcare needs. Kids with Down syndrome are less likely to have private insurance, less likely to have a medical home, and more likely to have unmet needs for care and family support services. Adolescents with Down syndrome are far less likely to receive adequate access to transition services than other children and youth with special health care needs. Current adult Down syndrome clinics only have the capacity to serve about 5% of the adults in this country with Down syndrome. And Down syndrome clinics may be geographically inaccessible to a significant number of individuals with Down syndrome. This, thanks to the Global Down Syndrome Foundation, this is a map of where Down syndrome clinics are in our country, and we can see that the brown states are the states that don't have a clinic, and there are a significant number of states that don't have any clinic at all. Even the states in orange, in some states, there's only one clinic, and that means a lot of travel for people from farther corners of the state. Next slide. I'm guessing almost everyone on this call knows this, but Down Syndrome Medical Interest Group USA is an interdisciplinary group of health professionals who are committed to promoting the optimal healthcare and wellness of individuals with Down syndrome across the lifespan. And we have had educational activities focused on the education of medical professionals from a range of disciplines. This is one of our big events for education. Our annual symposium is back to in-person this year after a 3-year hiatus of virtual symposia during COVID. And we're really excited about being back in person. Registration will be opening very, very soon, we hope. And this year will be in Orlando. Another educational effort that's a little bit newer is our DISMIC Speaker Series. And these are live events conducted as live webinars, and then are also recorded and available to watch the recordings. All of this is free and available on our website. And then DISMIC also encourages people who are thinking about starting a Down syndrome clinic or working to maintain a Down syndrome clinic. And so we also have had the business of running a Down syndrome clinic webinar series, and those recordings are also available on our website. And, you know, coming to the point, so the point of all this is we continue to see the gaps, the needs, and really want this information to be as widely available as possible. Dr. Chicoine had the amazing idea to think about starting a Project ECHO to really allow us to discuss with one another and learn from one another. And I love that the motto of Project ECHO is all teach, all learn. Seeing the amazing array of people who are on, I'm really convinced that we're all going to learn something from each other. ECHO started as a project in New Mexico to help bring information about hepatitis C and care of individuals with hepatitis C to folks around the state. And over time has just multiplied in terms of all the different topics that have had Project ECHOs associated with them. But I think the amazing thing is that here we are, people from all over our country with very a broad range of expertise coming together to discuss anonymized cases and learn from each other. I felt like I would be remiss if I didn't mention sort of our very important documents that give us some great baseline information. Again, I'm sure just about everyone on this call is familiar, but the health supervision document from the American Academy of Pediatrics is a great reference for general care for children with Down syndrome. On the companion website, healthychildren.org, that's a family-facing website. In English and in Spanish is a family-friendly version of those guidelines. Next slide. And then for adults, the medical care guidelines for adults with Down syndrome that were developed in partnership between DSMIG members and the Global Down Syndrome Foundation. And they also have a family-friendly version available on their website in English, Spanish, and Japanese. So I'm not going to talk anymore. I'm sure there's going to be some great conversation. But again, my sincere thanks to Dr. Chicoine for making this happen. Thank you.